One of the biggest misunderstandings about glute training after 50 has nothing to do with effort. Many people stay active, walk regularly, even do squats and bridges, yet still notice that the sides of their hips begin to look flatter and less supported over time. And naturally, they assume it is simply part of getting older. But in many cases, the issue is not age itself. It is the position and control of the pelvis. Today, I want to walk you through 3 simple movements that may help restore glute engagement after 50 by improving the way the hips and pelvis work together. No gym machines, no heavy weights, just controlled movements designed to help your body reconnect with muscles that often become less active over the years. And I encourage you to stay through the final movement, because that is the one many traditional routines completely overlook, especially when it comes to the outer hips and overall shape and stability. Before we begin, try something simple for me. Stand naturally in front of a mirror and place your hands on the top of your hips. Notice whether one side sits slightly higher than the other. Maybe one hip appears flatter. Maybe one side feels tighter or less stable when you stand on it. These small differences are extremely common after years of sitting, driving, reduced mobility, or repetitive movement patterns. What many people do not realize is that even subtle pelvic imbalance can change how the glutes function during daily movement. Your pelvis acts as the foundation for the lower body. When it moves well and stays properly aligned, the glutes can activate more naturally. But when the pelvis begins to tilt or rotate over time, other muscles often start compensating. The lower back becomes more involved. The front of the hips tighten. The thighs take over movements the glutes were supposed to handle. Gradually, the glutes become less responsive. This is why some people can stay active for years, yet still feel disconnected from their hips and lower body strength. It is not always because the muscles are weak. Sometimes the body simply stops recruiting them efficiently. And this is important to understand because many exercise programs immediately jump into strengthening without first restoring control and alignment. That is why these movements follow a specific order. The first helps improve pelvic awareness and reconnect the body to the glutes. The second introduces controlled strength. And the third targets one of the most neglected muscles involved in hip shape and stability. Let us begin with the first movement. Exercise 1. Wall hip hinge with side shift. Stand facing away from a wall with your feet about shoulder width apart. Position yourself so your heels are roughly 6 to 8 inches from the wall. Keep your knees soft and your spine long. Now gently push your hips backward until your glutes lightly touch the wall behind you. Your torso will lean slightly forward, but avoid rounding your back. From this position, slowly shift your hips a few inches to the left. Pause briefly. Then return to center. Now shift to the right. Move slowly and with control the entire time. You should begin to feel the outer hip engage on the opposite side of the direction you are shifting. Complete 8 to 10 repetitions total. If balance feels uncertain, lightly rest your fingertips on a chair nearby. One of the most common mistakes here is moving the shoulders instead of the pelvis. Your upper body should stay relatively quiet while the hips perform the movement. This is not meant to feel aggressive or exhausting. It is a coordination exercise. Its purpose is to help restore communication between the pelvis and the glutes before adding more demanding movement. And for many adults over 50, that reconnection is the missing step. Small corrective movements like this may help improve muscle recruitment and balance when practiced consistently and with control. Now that we have prepared the hips, we can begin adding strength. Exercise 2, wall-supported squat with heel lift. Stand facing a wall about 8 inches away. Place your hands lightly against the wall for support. Position your feet slightly wider than hip width, with the toes turned outward just a little. Lower yourself into a controlled squat. Do not rush the descent. Keep your chest lifted and allow the knees to track naturally over the toes. You do not need to squat deeply. A comfortable range is enough. At the bottom of the squat, slowly rise onto your toes. Hold briefly. Lower the heels back down. Then press through the feet and return to standing. Perform 10 to 12 repetitions. What makes this movement useful is the support from the wall. Many people unconsciously lean too far forward during squats, especially after 50 when balance and mobility begin to change. That forward shift often transfers tension away from the glutes and into the knees or lower back. The wall encourages a more upright posture so the hips can participate more effectively. The heel lift also introduces an element of balance and coordination, which becomes increasingly important with age. Try to keep gentle pressure outward through the knees during the movement. That may help the outer glutes remain active, and pay attention to where you feel the work. Ideally, you should notice effort in the hips and glutes rather than strain in the knees. If the knees feel overloaded, reduce the depth slightly and focus on slower control. Many people are surprised by how challenging this becomes when done carefully instead of quickly. Now we move into the third and final movement. This is the one that many traditional lower body programs miss entirely. Exercise 3, standing side leg raise with pelvic control. Stand beside a wall or sturdy chair and lightly hold it with one hand. Stand tall with both feet underneath you. Before lifting the leg, gently engage the lower abdomen just enough to keep the pelvis steady. Now slowly raise your outer leg to the side. Do not worry about lifting high. Only lift as far as you can without leaning your torso. Pause briefly at the top. Then lower the leg slowly with full control. Complete 10 to 12 repetitions on each side. One of the biggest mistakes people make here is trying to lift the leg too high. The moment the body begins leaning sideways, the lower back starts compensating, and the target muscle loses involvement. Smaller controlled movement is far more valuable than exaggerated range. You should feel this primarily in the outer hip. That area is often overlooked in standard exercises, yet it plays a major role in pelvic stability, walking balance, and the overall shape along the sides of the hips. For many adults over 50, this muscle becomes less active simply because it is rarely trained directly. That is why this movement can feel surprisingly difficult at first, even without added resistance. And that is perfectly normal. The goal is not speed. The goal is quality and consistency. These three movements work best together because each one builds on the previous step. The first restores awareness and control. The second develops strength with better alignment. And the third focuses on the outer hip muscles that support both stability and shape. You do not need to perform these every day. 2 or 3 sessions each week done consistently may be enough for many people to begin noticing changes in how they move and feel. In fact, many people first notice improvements not in the mirror, but in daily life. Standing up feels smoother. Walking feels more stable. The hips feel more supported during movement. Those small changes matter. They are signs that the body is beginning to move more efficiently again. And over time, that foundation becomes incredibly important. Because this is not only about appearance, it is about maintaining confidence in movement, stability during everyday activities, and feeling connected to your body as the years continue forward. If you found this helpful, share it with someone who may also benefit from it. And let me know which of these movements feels the most challenging for you right now. Sometimes the body is not asking for harder exercise. Sometimes it is simply asking for the right kind of movement in the right order.